Hey guys, what's up? This is Mike from the AMP Performance Center. We're here in the Recovery Lab coming at you live, talk about some different recovery tactics that we use here at AMP with our athletes, help them get the most out of their training and prevent injuries as much as we can. So in the next few weeks, we're going to go over some different topics, recovery tactics, injury prevention, reconditioning, mobility restoration, soft tissue techniques, you name it, we'll cover it. We're going to do this in a live Q&A format, so if you guys out there have any questions, please feel free, shoot us a line. We'll be happy to answer it and address your injury concerns. So for today's topic, what I want to talk about is some of the active recovery techniques that we use here in the AMP Recovery Lab. Like I said earlier, our guys train real hard in their off season, so we want to make sure that they're getting the most out of their daily training. So one of the most common questions we get here is, ice versus some of these other recovery tactics. And so what I would like to go over is some of the myths about icing, whether it's used for prevention or as a treatment technique. The new research out there is kind of showing us that icing may not be the way to go for some of these things. Overall, the myth, it's going to kind of slow down the recovery, the healing process, which is a normal part of how we heal and recover. So that inflammation that's present, it's there for a reason. So we don't want to completely shut that down. Again, there is a time and place. I'll still use ice in those post-op cases and, for acute injuries within 24 hours. That's if you get, a ball to the leg and it's really bruised up. 24 hours you can use ice, and then after that, we're going to shut it down. Okay, so some of these active recovery techniques that I'm talking about that we use in place of ice, first off, we go sports massage, Graston Technique, active release. These types of soft tissue techniques are very, very effective at helping athletes recover from session to session. You can also that's where you throw in your foam rolling, some of your self-massage techniques, lacrosse ball, the stick, things like that are also great tools to use on a daily basis to kind of help maintain, the tissue quality in those areas, as well as create and promote blood flow. And that's really the name of the game when it comes to, recovering from session to session during your training. So we like to use sports massage here a lot. Our athletes come in at least once a week, sometimes more than that, to just get some tissue work in. It really works wonders, helps prevent some injuries like we're talking about, and it also helps them recover from session to session. So the first thing I wanted to show you guys today was this device here called the Mark Pro. Okay, so the Mark Pro has essentially replaced ice for us here in the AMP Recovery Lab in most cases. This is for, like I said, after workouts, strenuous lifts, we throw the Mark Pro on guys, and what it does is it's a low frequency electrical stimulation device, and it helps to create basically what it does is it activates those type 2 fast twitch muscle fibers, and it basically turns your body into a pump. So for example, heavy deadlift day, you just get done, maybe PRing, or you do your 3-rep max, you're going to be sore the next day. So what we do is we'll put this on, and you can check out their website, www.markpro.com. They'll show you the full leg flush, which is one of my personal favorites. Basically what we're going to do is pad at the top of the hip flexor, bottom of the foot, and we're just going to let all of those muscles kind of, start to really activate and start pumping out any metabolic waste or, build up in those areas, and then also pump in, oxygen-rich, nutrient-rich blood so that they're getting the most out of their recovery. Definitely recommend the Mark Pro, to any athlete or person who takes their training seriously. It's a great device. We also have a coupon code. If you use AMP Athlete in the Mark Pro checkout, you'll get 5% off, and you can finance your device for free. The second thing that we like to use a lot here, and we actually just got this in recently, is the Norma Tech MVP. The Norma Tech is what you can see here is basically an intermittent compression device. And what this does is basically aid that lymphatic return in your body. So, we have the leg boots, we have the arm boots, depending on, which area you want to focus your recovery on. Obviously, you pick the appropriate boots. But for the leg boots, what this is going to do is kind of just, in a sequential order, compress and then relax, the tissue in those areas. So it'll start from the bottom where your foot is and work its way up, each chamber at a time, compressing, holding, and then relaxing. So this is another, active recovery way. So technically you're really not doing anything. You're just kind of sitting there letting the Norma Tech do its thing. But it's active recovery in the sense that it's utilizing the system that your body would naturally use to help you recover. So, for example, your heart, we know as a pump, is not strong enough to pump blood throughout our body. Our bodies rely on the muscles in our legs and in our arms. When they're flexing, it's aiding that venous return. It's aiding that lymphatic return to our core, to our circulatory system. So basically what this is doing is providing the pressure. Same thing with the Mark Pro. It's providing the electricity so that your muscles can do what they're supposed to do. So these are, like I said, active recovery techniques that are very, very effective. And we definitely highly recommend them as well. So just moving on, we'll talk about, one of the other things that we get asked a lot here is about DOMS, delayed onset muscle soreness. Anybody who's gone through a hard workout in that 24 to 48 hour period after, obviously you're going to be pretty sore. So A, we want to know why that happens, and B, we want to know what we can do to kind of limit that or get around it altogether. So the first thing that we can do is understand what DOMS really is. And delayed onset muscle soreness, it used to be believed that, lactic acid buildup in the muscles causes that soreness. First off, lactic acid really doesn't exist in the human body. It does in cattle, but not really in us. We're talking about lactate, which is a byproduct of the muscle the action of contracting muscles. For the most part, lactate is metabolized by your body within 30 minutes, 45 minutes after you're done exercising. So to blame lactate is kind of, one of those myths that has kind of held on for a fairly long time. The other thing that we're talking about is maybe pre and post activity stretching, whether that will eliminate or prevent DOMS from happening. And that's really kind of been proven as a myth as well. Whether you stretch before and after is not going to, limit your soreness. So what we do know is that we're looking for blood flow. And again, guys, if you have any questions about anything we're talking about, please feel free to shoot us a message. We'd be happy to hear it, especially any questions about these two items in particular. But getting back to delayed onset muscle soreness, what we're looking for are better options in terms of how to kind of take care of our bodies when we feel that breakdown. So DOMS basically happens, or that muscle soreness happens, mostly during the eccentric phase of your training. So that's on basically your negative rep. That's a common term that's used. So, that action is much more strenuous on the muscle, and the result usually is more damage. Obviously, what we're looking for is to damage those areas so that your body can heal back and repair stronger than it was before, more able to kind of deal with those forces better in the future, right? That's what our bodies do. We are adaptation machines. So we're putting a stress on the system, and our body is going to adapt to it by getting stronger. And obviously in the aftermath, we want to make sure we're kind of limiting that soreness so that we can get the most out of our next training session. So, again, going back to sports massage, if you can get, a clinician, physical therapist, athletic trainer, chiropractors are doing a lot of soft tissue work these days. Even your licensed massage therapists in your area can all help you with this problem. If you're on Long Island, definitely come check out the AMP Recovery Lab. We can help you, deal with any kind of injuries or training mishaps that you may have had, and help you kind of clean up some of the things that you may be doing, as well as give you access to these great recovery tools that we have. Another great option, like I said, these active recovery devices. These can, the Mark Pro, we've had athletes, deadlift heavy, squat heavy, do the Mark Pro afterwards, and basically have no soreness at all the next day. I mean, that's fairly unusual, but we have had it happen more than once. The athletes that use it on a regular basis all report to me that their soreness is very, very low, and if they miss a session, they definitely are feeling it the next day. So again, those active recovery things are what we're talking about. Your foam rolling as well are great substitutions. If you can't get someone to work on you, you can definitely work on yourself. Lacrosse ball, like I said, the stick. Some of the other things we use, thanks Dan, one of the soft tissue techniques that I love for recovery is Graston Technique, okay, or instrument assisted soft tissue mobilization. So I'll use these stainless steel instruments to massage my athletes in certain areas, whether they're restricted or have adhesions in those areas, or whether they're just generally sore and overused. We'll use this as well. And the Graston technique is excellent it's like a divining rod. It helps me feel adhesions and restrictions in the tissue, and then it allows me to kind of hone in on those areas and really help my athletes by being very, very specific with my treatments. The other really great thing that people really don't talk about with instrument-assisted soft tissue work is that it creates a lot of local blood flow. So if you're talking about injuries or overuse, repetitive stress injuries like tendonitis, epicondylitis, anything that has the word itis in it, that's superficial in the area that it's being worked, that's bothering you, Graston is the way to go. I've had more success with this modality than any others combined. I'm able to bring a lot of blood flow superficially to these areas, and even in the deeper muscle layers as well. And I've had athletes report to me that one treatment knocks it out altogether. Now, again, if you're having those types of issues on a regular basis, you really need to get evaluated at a certain point so that you can determine what is happening in your body that's causing that excess stress in those areas. Listen, we're athletes. Sometimes it just happens, but most of the time that there's a reason for that. And I'll talk about the injury equation. And the basic equation for most people is a postural or movement dysfunction plus repetitive stress equals a chronic overuse injury. Now, everybody's equation is different. We're talking about, you may have previous injuries, broken bones, torn ligaments, whatever those may be, previous surgeries, the sports that you play, the type of training that you do. All these things are in your particular equation. But, the basic equation, like I said, is movement or postural dysfunction plus repetitive stress. Again, that's training, guys. Repetitive stress is training, equals those chronic overuse injuries. So if tendonitis and those types of things happen with you on a more than monthly basis, you definitely need to see somebody, get yourself evaluated, do a movement screen, have a professional take a look at you and try to find the reason why that's happening. The cornerstone at AMP here is evaluation and understanding what the needs are of each individual athlete. So we will very commonly identify these movement flaws and then in the training work on fixing those movement flaws so that they don't come back in the future, right? And a lot of times this soft tissue work is part of that. We definitely, if you're short and tight in some areas and that's causing excess stress, we will do manual therapies to kind of help that process along of lengthening those over tight, short areas. And then obviously the training will help to correct some of those imbalances that may be causing some of your injuries. We use the tagline a lot: train, recover, evolve. That's really, those three words are very powerful because what they mean is that in your training, you're working towards a specific goal. You need to recover from that training, and that's going to help you as an athlete, as a person, evolve and get the results that you want to see. There's a lot of people out there who just go to the gym and they think getting sore and sweaty is going to get them results, and honestly, effort will get you so far. So what we want to do is kind of train a little smarter and understand what we need as athletes. For the most part, it's those little things that can make the biggest difference, especially in your high school, college, pro level athletes, even those weekend warriors out there. You want to perform at your best or even just do well at your job and in your daily life. If you train like an athlete, you're more athletic, you'll have more success in those areas. So again, if you guys have any questions at all, please shout us out. We'll definitely, we've got some time here where we can go over any concerns that you may have. Like I said, Graston Technique, you can check out their website as well, www.grastontechnique.com. If you're looking for a provider, they have a locate a provider section in their website, so you can actually search your zip code and find that person in your area that can help you with some of these issues. Again, having that support team is the difference between good athletes and great athletes. Who you put in your corner is going to really help determine your success in whatever athletic endeavors that you may have. Another question, moving on, another question that we get a lot is about the connectedness of our body. Everybody, you hear that buzzword out there, everything's connected, the head bone's connected to the foot bone kind of deal, and it's 100% true. The typical way we learn anatomy is to break down each individual muscles, right? All the muscles have an attachment point, an origin, and they have an insertion point, right? So they work as a singular unit. And then a lot of the information we have out there on training kind of goes back to the bodybuilding mentality of isolating certain muscle groups so you can get the most volume and the most strength out of that one muscle group, which is fine. If that's what you do, excellent, go for it. But for the most part, what we forget, or what we put on the back burner, is this concept of regional interdependence. And what that means is how one area of your body can affect the other, right? So what we're talking about are length-tension relationships, and we see this a lot in athletes who have the same injury a lot. For example, you look at some professional athletes who may have a lot of hamstring strains. Well, why is this happening? You think they're the most conditioned, they're in the best shape, they're training, pretty much all year round for their sport. Why do these hamstring strains happen? Listen, sometimes it's just bad luck, plain and simple. It happens. That's why guys like me have a job. But on the other end of things, it's usually those length-tension relationships in our body that will kind of determine our injury predisposition. For example, if your hips are tilted forward, we call this anterior pelvic tilt, right? Where your hip flexors are a little bit over tight, they're over short, maybe even from sitting all day, right? You sit all day, your body, like we talked about before, is an adaptation machine, and it will adapt to this position. It will make you the most efficient at this position. And this doesn't mix well when you're going to go to your CrossFit class after work and you've been sitting for 10 hours and you haven't been really stimulated, you haven't stimulated your nervous system at all, and then you go to your WOD and you're doing 100 burpees and 100 hang cleans and whatever else you may be doing. So it's important to understand that what we're doing most of the time is going to be where our body's adaptations lie. So again, like I said, if you're sitting at a desk for 8, 10, 12 hours a day in some cases, think about that amount of time that you spend behind the desk versus at your sport or in your gym, right? Obviously it's staggeringly weighted to one end of that spectrum. So when you are training, it's important what you're incorporating some of the things that can help balance you out as a person, as an athlete. So going back to our hip example with hamstring strains, you're sitting all day, your hip flexors are super tight, and then you get up and what's happening is that those hip flexors are dragging your pelvis down and actually causing your hips to tilt forward. So when your hips tilt forward, what happens is now your hamstrings are on a little bit more tension, right? They're a little bit longer to compensate for that tightness in your hip flexors, and then you go out and run and then whang. That's when that hamstring strain happens. It's that little bit of extra tension that kind of overloads the system, and those are the things that we're trying to prevent through the training. So if you can identify that movement dysfunction or that postural dysfunction ahead of time and understand that that is an injury predisposition, now what we can do is kind of eliminate those a little bit at a time by programming you or your athletes according to what they need. It's great to build strength, but building a house on a crappy foundation is still a crappy house. So we want to build a solid foundation of good posture, good movement efficiency, and then we can build strength for days on top of that and know that you are a sound athlete, well-rounded. Again, guys, anybody who's just tuning in, please, we're talking about recovery tactics, active and passive recovery. We're talking about injury prevention and also reconditioning. There's another difference between rehabilitation and reconditioning. Rehab is what you do in that period right after you get hurt, right after you have surgery, where you're kind of just getting the movement restored, getting your range of motion back, maybe building some basic strength. Reconditioning is what happens after those things are met. You have full range of motion, you have enough strength to get through some of your activities of daily living, but now you want to go out and play football, you want to go out and play lacrosse, baseball, soccer, whatever it may be. Just being able to live your life pain-free is not the same as being able to succeed in your sport pain-free or even injury-free. We see a lot of athletes who finish their round of physical therapy, and all of a sudden, they're hurt again, as soon as they get back on the field. So first of all, previous injury we know is the #1 predictor of future injuries, and that number is overwhelmingly true. So, in a reconditioning model like we have here at AMP, what we try to do is take that athlete from basic function to high-level function, high-level athleticism by restoring all of their strength, that active, dynamic, and then building beyond that and even making it better than it was before. Again, every athlete who gets hurt, there is usually something there in their equation that led to that injury. So, if you can look at it through a fine glass and find out what that thing is, you're more likely to have success preventing that injury in the future. We're all talking about, Tommy John surgeries in baseball, how it's very, very common now. And, what people need to understand is that, guys are throwing harder, they're starting younger in sports, and this is sports in general, not even just baseball. So all of those factors kind of lead to these trends of having more and more of these injuries happen. So for those athletes, it's even more important to offset some of that repetitive stress with proper training, proper nutrition. So like I said, we're new to this Periscope. We're going to start to do this, on the recovery side, I'd say about once a week. But we're also going to have Coach TJ Lopez talk about nutrition. We're going to have Coach Dan Michaels talk about, performance training, strength training, unconventional training methods. So we got a lot of stuff for you guys. We like this live format. We really think it'll be a great way for us to interact together and, have some of you guys lead this discussion. We could tell you what we see on a day-to-day basis, but we want to know what you guys see, what you guys are having a hard time with, what you guys are working on in your own training, and then please let us know. Again, give us questions, and we can definitely help maybe answer some of those or dispel any other myths that may be out there. We're running a little short on time here. I think, what we'll do is maybe wrap this one up, but be sure to check us out on Twitter and Instagram at @amp_athlete and on our Facebook page, Athletic Movement Protocol. In case you guys missed anything, if you may have tuned in late, don't worry about it. I will send you all the notes in the AMP newsletter. If you're not signed up for the AMP newsletter, please get on our website, www.athleticmovementprotocol.com. Right on that main page, you'll see the AMP newsletter. You can just throw your email address in there, and I'll send you these notes at the end of the week. Have a great day. Make sure you tune in tomorrow for Coach TJ's nutrition Q&A. And again, any question, guys, please feel free to shoot them at us. Signing off from the AMP Recovery Lab. Take care.